I was thinking about this. I'm so excited about this bill for many reasons, but mostly because I'm a parent of a medically complex child, and I didn't even know that that's what it was called. But I was reading through here, and I thought, okay, I guess I fit that bill. My husband and I are blessed with the awesome responsibility of helping our baby girl walk through daily dialysis. When she up to transplant in the fall, my husband's probably going to be, hoping going to be her kidney donor. She was born. She's the first kid ever on record to survive her condition. I found out last year I was pregnant with her, and they told us she's not going to live. She will miscarry or she will die when you have her. So that was my summer last year. But through some amazing doctors who were willing to believe for the impossible, we found a new way, or actually a very old way, but a way to treat her. And she was born breathing on her own, but we had a problem of no kidneys. And we had her 28 weeks premature in Oregon, and we had planned to have her up at Hopkins. So all of a sudden we're trying to figure out 4 days of labor. That morning we're excited she's alive, she's breathing on her own, and well, where are we going to take her, and what are we going to do? And it set off a flurry of calls. You know, the folks in our area had never treated a baby that young in that way, and so they said we have to transfer. But where do we transfer, and how do we get there, and who pays for it? You know, we're fortunate. We have health insurance, and even with health insurance, it was a battle. And so we were transferred. I remember showing up at it was 11:30 that night. I had gone on the live flight with the clothes on that I had showed up to the hospital in. It was lovely. And my husband caught a commercial flight. I remember walking into that children's hospital down in California just relieved, because we were in the right place to treat what she needed. And honestly, we were able to sleep. And that became kind of a long process. But we now, our medical needs span about 3 states and a team of medical specialists. We're up in Seattle for management dialysis. We go to Lucia Packard for transplant workup, and then we stop in Oregon and Southwest Washington every now and then. So it is an unusual journey that we didn't expect to be living, but we've been there. We are there. And so when I heard about this bill, I was thrilled, because I met so many moms and dads in families in both the NICUs and the PICUs who don't have medical insurance. I've had moms from across the nation who've had my diagnosis call me and say, I need help. And we found doctors that will treat them in other states, but all of a sudden, wait, Medicaid is a roadblock. It's no longer the safety net. They can't get coverage because they can't get it paid for. I mean, this is the daily struggle of families. So what if we had Medicaid in Washington State? We wouldn't have had the ability, most likely, to transfer, because Medicaid, which is supposed to be this amazing safety net, becomes this roadblock for these families. So we have to do something. And I'm so excited that doing the right thing saves money, right? That's awesome. It's going to make Medicaid, bring it kind of from a 19th century system into a 21st century system. It makes sense. And I also believe that we're going to make care more efficient and effective for families. These kids with all these medical specialists. I mean, my husband and I are both college educated, right? I worked on healthcare policy, and I've actually worked on insurance policy. And we are at times swimming, trying to understand how to knit together our specialists and knit together payments and figure out where we need to be. My husband has literally stepped out of law school to be a full-time caretaker. How do you do that if you're a single mom on Medicaid? What are you supposed to do? Well, that's why this is going to make it more effective and more efficient to create a model around it. And what I love about this is we're talking about a medical home not within a brick and mortar building, but in a region. So if you have a specialist in downtown Seattle, but you're at Seattle Children's Hospital, they're going to help contract and collaborate so you get the care you need, but you don't have to be the medical expert. So this is a win-win-win. It's bipartisan. We're thrilled about it. It's a good time to push for it, and that's what we're going to be doing. And I'm excited to join my colleagues, and I think I get the privilege of introducing a friend of mine who represents, well, I say she represents Lucille Packard, but she represents a whole lot of other things in that area, including Silicon Valley, but who's a passionate champion for children's health, Congresswoman Erin Issue.